A question that we hear often is, why do we refer to other specialists? Why are we sending a baby out for a consult with a lactation consultant, a chiropractor, craniosacral therapist, an occupational therapist? Each baby and each patient is so unique, and the approach that is taken for each baby is going to be very dependent on what that patient needs. Often when we see tethered oral tissues and restrictive movement of the tongue, these babies have other issues that require intervention in order to have optimal outcomes. If we were to just treat the tongue tie and not address the other restrictions and the compensations, that baby's going to have a much higher likelihood of having scar tissue or having a reattachment. And if we're going to go through this, it's very stressful for families to make this decision. If we're going to put a baby through this kind of treatment, we want to make sure that we have the best outcomes possible. And while I wish I could just say it's an easy one-stop shop kind of procedure, we've been doing this long enough to know that that just isn't the case. The babies that have access to multiple sets of eyes on them from different disciplines end up being so much more successful. We also work very closely with lactation consultants because while babies are very resourceful, they can learn how to breastfeed and function dysfunctionally. Once we free the tongue and give it movement that it's never had before, they have to relearn how to use it properly in order to attach and latch to the mom without causing her pain and without having any issues transferring milk. So just because of the successful outcomes we've had in the past with this approach, we've decided that that's our commitment, and we're going to continue to go.